Welcome to True L Tuesday, and the truth will set you free. He governs me, tells me when I can start. Okay, we're going to talk about gait for the first part. Now, this is one of the things that most doctors are missing. Okay, because if you have a disc injury, a neck injury, or anything else, and you're not looking at the feet, the knees, the pelvis, how the person walks, it's not going to work right. Okay, it's just not going to work. Now, the second part of the talk that I think won't get by the censors, I know, I'm sorry, there's a few Canadians here. We used to have a freedom of speech in this country, but I know we don't have it anymore. Okay, so I've got to divide the talk up into two: stuff that I think the censors will get away with, and stuff that I think that we can get away with. So Dr. BVIP, this won't be. You won't have an interrupted feed. You're going to be able to see it. I encourage you to get on this because I'm going to give a huge amount of data on how to change our world back to what it should be. Okay, where you have rights. Okay, where rights that cannot be separated from you as a human being. Now, it's also going to be on Extreme Health Academy, so I encourage you to go there. I just did a 2.5-hour webinar with them Sunday, which was a blast. Okay, now, I got into this, okay, before I was a chiropractor. I was a contractor. I'm walking across the street, and I'm hit by a car. Both my legs are broken, sternum fractured, skull fractured, front teeth knocked out, heart and liver bruised. Now, I know emergency rooms now. Has anyone in here ever tried morphine? Okay, damn. Okay, it was almost worth the hit. Okay, but I found out that I've got an addictive personality. So the first shot I really friggin' needed. The second one I kind of needed. The third I just wanted. And I never got a fourth shot because it scared the shit out of me. Okay, so when it comes to regenerating joints, because the medical world, they don't see a lot of regeneration of joints. Okay, do you know why that is? What's the number one drug that they're going to give you if you have joint pain? Tylenol, that's a good one. Nobody knows how that works, so it's in a different class. Advil, Motrin, Aleve, okay, those are non-steroidal anti-inflammatories. Where both those classes of medications, they destroy the building block of cartilage. So if I got somebody with joint pain and I'm giving someone a pain reliever, okay, and it destroys their joint cartilage, guess what the medical world is going to think? Well, joints don't regenerate, okay? And I actually have to talk to people, to medical doctors about, and I'll say, well, we have to regenerate your disc, we have to regenerate your joint. Regenerate joints? And it's like, dude, mellow. Okay, so if anyone is confused out there, let's walk them through this. Do you have living tissue or dead tissue in your body? I know, but stem back, because what you're going to see a lot of time, I don't know, I'm not a doctor. Okay, so it's alive. If you have dead tissue in the body takes care of that. It's called a bruise. Okay, the body gets macrophages. They go in there, chew up the abnormally placed proteins. It works really, really good. So let's look at this patient. Okay, we're looking at multiple symptoms, dizziness, balance, everything else. But let's say you twist an ankle. Okay, are you going to be walking good or a little bit crooked? A little crooked. Okay, will that cause the pelvis to be unstable? Yeah. Now, we have an automatic nervous system. One part keeps you alive under stress, and that's the sympathetic or fight or flight. The other part regenerates tissue. That's located in the pelvis and the neck area. So if anyone in here has ever had back pain, do you walk like this when you have back pain? No. Damn. Okay. Everything. I mean, it's so when you look at this, if you're trying to fix a disc, okay, and I'm talking a disc in a body, like here, do you think possibly any world that this disc could be a problem and everything else be okay? No, you can't smoke enough weed to think that, okay? Even in California. So it doesn't make any sense. So, if you're laying in bed all nice and comfy and someone comes up with a hammer, ex-lover or, current lover, and hits you with a baseball bat, you might have an injury at one disc and everything else be okay. Okay, but that's not how human beings work. Okay, there's going to be a trauma where the head's been thrown forward, body off to the side. Now, when I was teaching the lab for biomechanics, we did different gaits, like, scissors gait. Okay, that's cerebral palsy, that's brain damage. You can see, certain types of stroke gaits. You can see high stepping gaits. So gaits are really a cool tool to look at pathology. So what I encourage you to do, and this is where the detective work comes in, look at how people are walking. Okay, last week we talked about people's body posture, position, everything else. But if they're walking, are both their hands going up to the same position? No. One hand's going to go up a little bit higher, one shoulder's going to be down a little bit lower. There's going to be certain variations on that. Does that make sense? So if you have somebody with a long-term back problem, is that going to change their gait? Yes or yes? Of course. I mean, we're just talking basic common sense. So the sciatic nerve comes out of the base of the lumbar, comes out of here, and comes through this little opening down here, goes down the back of the leg. Okay, you've got disc injuries up here that can be involved. But what's on the pelvic floor? Everything. Okay, I mean, guys can't say erectile dysfunction, so we say ED. Okay, but also bowel and bladder control. I mean, I'm looking at the TV and they say, yes, now I have this thing that I can pee in my pants and not worry about it. And this is for adults. Okay. And it's like, depends for adults. Why not look at the problem? Because if you have compromised nerve supply, and this is literally the pelvic floor, which is innervated by the pelvis. So how many people have had, hysterectomy? Does that mean that there's instability in there, that you're removing organs? Yeah. Okay, what if you've had, a colonoscopy? What if you've had the appendix removed? I mean, if you've had the appendix removed, you got a 60% increased risk of colon cancer. I mean, these are not benign procedures. And people will go in there and do a laparoscopic, and they'll say, oh, yeah, just we remove the appendix. It doesn't have any function at all. Yeah, unless you look that it's there to repopulate the intestinal tract if there's been diarrhea. And your body is designed to have diarrhea to replace the intestinal flora. I mean, it's brilliant. But now in our lifestyle, we're not actually designed to sit on this bone here, this butt bone. And when you do, in fact, can anyone name the muscle that crosses the back half of this? There isn't any. And this is the kind of teacher I was. You would have to write that in. Name the muscle that crosses the posterior aspect of the SI joint. You would have to write in, there isn't one. I know. There's a special place in hell for teachers like that. I mean, the piriformis is on the inside, on the front portion. So how many people are misdiagnosed with piriformis syndrome? Oh man, a muscle's just spasming out. Does that ever happen? Like, have you ever had a piece of chicken and it just starts running around the floor? No, muscles respond based on the environment, particularly when you're talking about a muscle that crosses an unstable joint. So people with piriformis syndrome look for pelvic instability. Does that make sense? It should. When you're looking at bowel and bladder control, this all has to do with the nervous system. So if you have disc injuries anywhere, trauma in the past, head thrown forward, all of those traumas, is that going to alter how your body views itself? Absolutely. Now, so what could possibly cause high blood pressure? You know what the medical world says is the most common cause? Idiopathic, unknown. Okay, now, would you go to a mechanic that has no idea what's wrong with your car, but he has a whole bunch of therapies for it to make it work better? And you're going, hey, the car works fine. No, we're going to reduce the pressure of the gas to the carburetor or the fuel injector. We're going to do all of this stuff. Of course, there's going to be damage to the fuel filters, like the kidneys. There's going to be damage to the brain. We're going to be shutting down oxygen to the brain. There's going to be a lot of different things, but your vitals look a lot better. It's foolishness. It's just ridiculous. Pelvic instability, bladder problems, pain with sexual dysfunction. Now, look at the lumbar up there. Now, is that straight or is that off to the side? Multiple traumas. Now, can you imagine in a world, and I mean, that you would think that disc is the problem and not look anywhere else? But this is our modern world. It's mind-blowingly insane. Okay, for one, you're getting an MRI with you laying on your back. Okay, that means that you got gravity pushing down and you got the table pushing up. Okay, now inflammation distorts the MRI. Body position distorts the MRI. And so, but again, in stupid world, pain here, Oh, we found a disc bulge. Okay. And again, you cannot have a disc bulge and have everything else perfect. Now, if you have a disc bulge long enough, it's going to start to make the gait change. It's going to change the shape of the foot. It's going to change the shape of the dynamics of the knee. It's going to change the dynamics of the pelvis. Does that make sense? And people are saying, well, gee, doc, do you x-ray everything on everybody? No, only what's appropriate. You know, and I'll be, you know, doing a consultation with someone, and I'll go, what was your neck problem? What accident? I didn't have any accident. I want to get, you know, I do it with a clipboard. I want to have a mirror on the back of the clipboard and say, dude, this is what I'm looking at. What happened to you? Because people will say, no, that was years ago. I just had a patient, he went through the windshield of his car when he was a teenager, but he was fine. Does anybody think that he was fine? No, he just didn't have symptoms. So when you have a pelvis, now, if you've ever been to another chiropractor, we don't do this stuff, but if you got adjusted, felt great, you had that big pain relief, got warmth going down your legs, you feel amazing, you get in your car, you drive home, when you get out of the car, the pain's back. Okay, have you heard that before? That's because they're adjusting the pelvis when they shouldn't be. What you have to do is the pelvis is a perfect joint, and doctors burn this in your brains. Okay, it's a perfect joint. It becomes unstable if there's disc injuries above or altered biomechanics below. And the way you take care of this is you stabilize it. You have to stabilize it, and that's with the trochanter support. And that's what this thing is. And this is something that usually lasts for about a month, month and a half, because it takes about that much generally to reposition discs. We have heavier duty ones on people with scoliosis, but you have to stabilize it. You can't adjust it. I mean, we might go 1, 2, 3 months before we're adjusting the pelvis in order to correct the disc injuries above. And that's just smart. But also, when you've got the pelvis and you're sitting, we'll use this at the junction of the rib cage and low back to stabilize and reposition everything. Wait, I thought we were talking about pelvis. Yeah, this repositions the torso. So you put this back there, it repositions this massive chest, okay, over the lumbar, so it gives more appropriate biomechanics. So you have to look at everything. But stabilizing the pelvis is huge. Here's a person with knee pain. Can you imagine a medical system that looks at the knee and doesn't look at anything else? I know, it's insane. But that's our world. And what's worse is physical therapists, they're pretty sharp when it comes to the body, anatomy, and physiology, and medical doctors really aren't. They're skilled in what chemical to give you to alter your physiology. The problem is the medical doctors are running the physical therapist. So if you have a knee injury from like a workman's compensation or some ridiculous thing like that, you got a knee injury. Are you going to be walking good or a little bit crooked? So can you have a one knee symptom, but you can never have a one knee problem? You're going to have two. Either the weight is going to be taken up by the other side, it's going to be working double. This is going to be changing, the pelvis is going to be off. So you have to look at everything. So if somebody comes in with one knee problem, guess what? You got to look at everything. Does that make sense? Now the foot is amazing. That's why I wear shoes that give me full range of motion. You got 4 arches, you got 2 running lengthways, 2 running crossways. So it's a cushion. Now at the bottom of these arches, there's a fascia called plantar fascia because it's on the plantar surface. Okay, and you might say, oh, I heard of plantar fasciitis. Okay, that's because the foot is flattening out, straining that fascia, because that fascia is only there for a secondary thing. So like if you're jumping off a curb or jumping off, you got that fascia to take up some of the function of the muscles of the foot. Now, if you have chronic compression of that, okay, then the foot flattens out and the foot starts to distort. Because the way a normal human foot is supposed to look is the toe is supposed to be going straight, maybe even a little bit away from the toes. What you're going to see if you have compromised nerve supply is the toe is going to start leaning, big toes start to lean towards the other ones. There's also going to be a prominence here. And people will call it bunion formation. But when you look at the foot, there's a calf in the back. Now that calf is hugely important. if anyone's going through their boards, there's two names for the Achilles tendon and triceps array. Triceps array, there's three muscles down there. Okay, one of them is the soleus, and this thing is amazing. It has veins in it. It has a pump. So does that mean that varicose veins aren't a problem of genetics? Varicose veins means that the deep veins inside of the soleus aren't working? Yes or yes? Yeah, so it's foolishness to go in there and have the veins stripped unless you're going to look at the discs in the low back, to look at the pelvis, to look at the biomechanics of the foot. Okay, so things don't happen randomly. It requires common sense. Thanks. I knew it. It's just been so long since I've heard it in public. Okay, normally it's common sense. Okay, with a mask over. So you got to look at the pump, but also the way the foot works. It's got to come up. Now you're going to see the majority of kids today that are fully vaccinated. Not these guys. They're normal. Okay, you're going to see toe walkers. Okay, and what are toe walkers? They're like this. Okay, have you seen that? Yeah, you'll see it in every store. That's upper motor neuron lesions. That's brain damage. These kids are getting 72 doses of 17 different vaccines before they're 18 years old. That's causing inflammation, and they're starting to get toe walking. Okay, that is a bad sign, particularly if you like humans. But one size fits all when it comes to medications. So when you see this, this is not from bad shoes. Okay, and in fact, those giant red shoes are not bad. The girl wearing that, does she feel sexy? You betcha. And do guys like looking at it? You betcha. I'll fix any damage you girls do. Don't worry about it. Three sisters and a mom. My mom used to wear high-heeled tennis shoes. Okay, I'm not kidding. Her heels were she had to walk on her tiptoes her whole life. But that is weak intrinsic muscles of the foot. So wait, where the nerves of the foot come out of? Oh, the pelvis. So does that mean when you see bunion formation, now remember, this isn't, well, my grandmother had it, my uncle had it. Yeah, okay, cool. You all had crappy lifestyles or similar traumas. This is not a human foot. Human feet, the toe goes straight, maybe even a little out. So this is a red flashing warning light to tell you that there's compromised nerve supply in the pelvis. So when you see this, if you ask somebody, how many bowel movements a day do they have? Okay, if they say 2 to 3, that's amazing. That means that they've got a stellar diet. They're taking something, because like this, typically, they're in a fight or flight state. It's a sympathetic dominant state. So good sleep patterns or poor sleep patterns? Poor sleep patterns. 1 poop a day if they're lucky, honest to goodness, unless they're doing certain vitamins or minerals. Are they going to have a good pelvis or an unstable pelvis? Have to be an unstable pelvis, because the foot is a cushioned spring. Not that one. That one's flattening out. Now, you've got, again, I used to teach doctors how to cast the feet to make an orthotic. Okay, in 23 years now, okay, I prescribed 2, both for patients who had their toes removed. Okay, and that's a bummer. Okay, because when your toes removed, you have altered mechanics, you might need an orthotic. But when you have this, that bunion can go away. All you have to do is restore the nerve supply, because is that bunion really the problem? Is that really growing? Or are the muscles inside of the foot weak? They are weak, and it's altering the biomechanics. So when you see that, good pelvic function or poor pelvic function? Poor. So this is just a little bit of detective work, because when you start utilizing the whole foot, you're going to start to see that big toe start to come out. And right below that red spot on the picture on the left, where that muscle is atrophying in, you're going to start to see that fill up, and then that big toe is going to start to come back where it should be. Does that make sense? Yeah, it's just common sense. But now, let's say you've had part of your common sense removed, and you think back pain involves just the back. Okay, you're not going to look at pelvic instability, you're not going to look at the gait, you're not going to look at how the calf works, you're not going to look at the dynamics of the foot, you're just going to fix the back without paying attention to the foot. That's impossible. You're never going to get a permanent correction. This is why we educate the patients on, this is the problem. No, it hurts right here, doc. Okay, great. No, the bunions run in my family. No, bunions don't run. Okay, so all of that stuff, and I got to do this every patient. because they're not used to appreciating that their body is intelligent and adapts and is designed to live here. Okay? I mean, obviously, you get people with masks. So, how do you correct it? Now, if you look at the girl who's pulling up her foot, she's pulling up trying to stretch it like crazy, right? Her foot is barely bent to 90 degrees. Okay, her calves are super tight. And this is an exercise for how to stretch the calf, and it's horrible. So what you want, and we have a block, and it's called a 4x4. Okay? Hey, it's a medical device. Watch it, or I'll throw it at you. Okay, and this, the ball of your foot goes up on the block, the heel goes on the floor, and you bend and hold this for 1 minute, twice a day. So you put it where you brush your teeth. That way, every Saturday when you brush your teeth, you'll do it at least twice. Hopefully you're doing it daily. Okay, but it's that simple. Really? All you got to do is stretch it 1 minute? Yeah, if you're restoring the nerve supply to it, and then you have to utilize it. You got to walk barefoot in the grass, hard stand, unstable surface, because working those intrinsic muscles of the foot are the key. And most people are using a shoe that balances like that. I mean, it's horrible. And in fact, the shoe that I use, literally, this is a shoe. I mean, it's legit. I can walk on the railroad tracks, the rocks next to it. I wouldn't walk on nails or broken glass, but it works really, really well. Okay, to give you the full range of motion. Now, if you start walking in shoes like this, it's a whole learning experience. Because if you're used to slamming down, because most tennis shoes will have a big, thick heel here, then an arch support, and then some pad over the so you can heel strike all day long and not have an issue. But that's abnormal mechanics. The way the foot is supposed to go is your heel is supposed to hit, and then the foot rounds over, so the outside of the shoe hits, and then it plants like this, and then you push off. It's amazing the way the foot is working. And that's why when people come in with orthotics, I say, the foot is actually a good design, but I have bunions. Okay, let's restore the nerve supply, and the bunions will go away. And this is all for somebody coming in for back pain, because if you're not paying attention to how they walk, you're not going to get them better. Okay, now knees, hugely important. You've got a calf on the back of the leg. It has a pump in it called the soleus. The joints in your body are hydraulic. That means they need fluid. So if you have an abnormally shaped foot, are you going to have good motion of that foot or poor motion? Poor motion, almost 100%. Okay, rarely, 1 out of 100 I'll see has good calf motion if they've got bunion formation or knee problems. Because if you got knee problems, you're not going to be walking correct. Now that knee is hydraulic, it needs fluid in it. And you need a good functioning pump on the back of the leg to get the fluid to the knee. You're also looking at patellar tracking. You've got a quadricep that holds that patella in the middle. Now, if you have a disc injury in the low back, that patella is going to be located off to the side or somewhere. So you have to do what's called a patellar tracking test. Okay, but if you have low back pain that's been there for a long time, is that going to alter the foot? 100% or 100%? Is it going to alter the calf function and the knee function? 100%. Does that mean that the gait is going to be off and the pelvis is going to be off? 100%. Okay. You cannot have an injury in the back, okay, without paying attention to how the gait is working. Okay. How many people do that? Not many. Not many, because, just like our governmental system, the medical system is not open to understanding new things. If it's to prescribe a drug, the medical system is very interested in giving you an experimental medical procedure. But if it's to restore normal biomechanics just by giving you a highly technical thing like this, okay, or telling you to walk barefoot in the grass, okay, which gives you an uneven surface, all has an electronegative surface, so it's a grounding. I mean, it's fantastic. But now meniscus can regenerate. Meniscus is alive. Now, what you're looking at here, this is the top of the tibia. And that's one of the bones I broke. I broke a lengthways fracture when I was hit by a car. Okay, so the tibia has got this like meniscus on it. And doctors will say, well, it's avascular. Okay, avascular means it doesn't have blood vessels. Okay, and that's true in the middle part, because my femur is now putting pressure on that. If I have blood vessels in that opening area there, not the red part on the round, they would be crushed. But the knee gets its nutrients through movement. And this is why when you walk, guess what happens? The knee has a negative pressure where it swings in the air, then you stand on it, it has a positive pressure. So just walking, you're hydrating that joint, as long as you got good hydration, good blood, good fluid. Now what we'll do is we'll put a massive weight. And for the average person, 10 pounds, a guy like me, 20 pounds, okay? And we'll just dangle that knee, because you don't want to lift it up. If you lift it up, you're driving that kneecap into that joint, and that's not good. This is a ligamentous-based exercise where you're just dangling the legs. Now, if we have someone with balance issues, okay, just had a gal, I think it was 14 prescriptions. I know, 15 would make her better. Quiet. There's a pharmacist in every crowd. Okay, so I know, this is modern medical care, you know. Oh, God, it's stupid. Okay, so in that case, do you think she has good balance or poor balance? Good proprioception, poor proprioception. Poor, she's drugged in the max. We had one gal who crashed her car out here who was on 32 prescriptions. And she gets out of the car, she says, I'm not stoned. These are all prescriptions. Okay, yes, miss. Click, click. Okay, so the ligamentous-based exercise to distract that joint, and you're swinging the legs, okay? Now let's kick it up a notch. Let's have a little like bucket or chair or something that you can tap on. And what you'll see, and this is going to be tough for vaccinated kids, adults who are doing cholesterol and blood pressure drugs, people on antidepressant drugs, all of these, and people that have allergies and they're taking cholinergic interrupters, those all have brain damage. So when you're swinging their legs, you're going to see that they're not exactly even. And that's okay, because swinging the legs back and forth actually get both halves of the brain to fire off correctly. And if you're tapping something, that gets more stimulus up to the brain. So literally regenerating the knees, is that going to change how the person walks? Absolutely. But we can kick it up a notch to give them a cross-crawl aspect of that to help balance and to help everything. Gosh, I thought it was just about back pain. I mean, can you imagine that? That's why it's like, oh, dude, here's a non-steroidal anti-inflammatory. That'll take care of it. Wow, that is not a doctor. Okay, that is just a sham artist. And we really got to change this. And this, when you're swinging that leg, okay, just very, very little bit of dangling, you will literally start to regenerate the meniscus, because the meniscus is alive. You can regenerate it. It's amazing. Now, if you put heat on the joint while you're doing this, let's say I put a hot cloth on my arm, what color does it change? Red, because the brain senses that difference in temperature and it opens up the blood vessels to equalize the temperature. So we're tricking the brain to increase blood flow. Oh, the joint's hydraulic. How about we put moist heat on that while we dangle the knees? Damn, that makes sense. Patellar tracking. This is hugely important, particularly when you're talking about disc injuries on the low back. That means that you have that leg, you grab that patella, and you pull it down and away. So in the middle of it, like let's imagine this is the patella, you pull it down and away, and if that hurts, it means vastus medialis is weak. If you grab the patella and pull it down from the lateral to the medial aspect, if that hurts, then you got vastus lateralis that's weak. And so it's really a simple exercise to do. Doctors, if you don't know how to do it, let me know. I'll show you how to do it. It's pretty simple. And if you look at our knee health video, it shows you. But that is going to be an asymmetrical exercise that you don't want to do very long. Maybe a week, 2 weeks tops, because if you're restoring the nerve supply in the low back, you're correcting the disc injuries. Muscle imbalance is correct really, really quickly. So when you're looking at this, look at the lumbar, okay, before and after. Do you think that this person just had a lumbar issue? It is impossible to have that. You have to look at the whole body. It's called holistic, but good God, Anything else? How could anything else make sense? Anything else, if you're looking at the symptom and you're looking at the symptom of the area and you're not looking at the causative factor or how the body's been adapting for years, that person that went through the windshield, okay, do you think they had some areas of dysfunction that they adapted to? Yes. Were they aware of it? No. They work every day. You get people like that. You say, you never miss a day of working? No, I never do. Okay, yeah, for your brain to register that it was a trauma, it would have had to taken you out. Not much does. This is the kind of stuff that you can do to stabilize the pelvis, to change everything. But if you've had a disc injury, a neck injury, a mid-back injury, and you got a doctor that's not checking the feet, the knees, and the pelvis, they are not doing you a good service. Does that make sense? You have got to find somebody that does that. We're going to elevate this profession, and I'm talking the medical profession, physical therapy profession, chiropractic profession. We got to elevate it because humans are divine. Okay, they're going to give symptoms for a reason, and that symptom is never lack of medication. That was it. Thank you. At least I got one person that got that. So what can you do to take care of yourself? This little foam piece, a rolled up towel, water bottle, whatever. The bottom of the elbows is the bottom of that. That's where it goes. Amazing. 20 minutes in, 10 minutes out. Why 20 minutes? Because human tissue, just like every kind of tissue in the world, if you put any force loading on a substance, it'll spring back to its original unless you put that force loading for a long enough time and a good enough force, then it gets the new position. Okay, that's the first one is elastic, and this is plastic deformation. Human tissue crosses that plastic elastic deformation curve at 18 minutes. So how long do you think you got to do this? 18 minutes. So, and since people are going to think you're being too picky, no, I say 20 minutes in, 10 minutes out. 20 minutes in, 10 minutes out. So if you're sitting for 5 hours, bitching, you're putting it in there. You can also use this fancy medical device. Okay, bottom of the elbows, put it in there. Just don't open the top, otherwise your seat will get wet. Okay, but this works. Okay, anything to decompress and to get that joint working. Does that make sense? Now we're going to continue on to a subject matter that I don't know is appropriate for the sensors. Okay, it's appropriate for humans, but not appropriate for sensors because they got their fact checkers, okay, which, you know, I remember, I disagree with what you say, but I'll defend to my death for your right to say it. That went way out. No, you say anything like Cinco Hey or anything like that, you know, you're going to be shut down. So we're not going to go into that. We're out? Oh, okay. So I'll see you later. This video will be posted. If you're on the Dr. B VIP site, you won't see an interruption. But we're going to start in on how to get your freedoms.